going on, y'all? Damian Washington here with MS Views and News, MS Views Now. We've got many special guests on this program, and today we have Mindy Eisenberg. Mindy is a yoga therapist and director of Yoga Moves MS. Thanks for coming here today and speaking with us all in the community about movement and MS and yogas and such. Mindy?
Namaste. Thank you for having me, Damien.
Peace and namaste. So, yoga moves MS, that's pretty specific. How do you go from yoga and MS to yoga moves MS? Like, do you have MS or did like someone in your life have MS before? Like, what's the story?
You got it. You got it. My mother had primary progressive MS back from when I was a little girl.
Got it. So, mom had primary progressive MS, so you were exposed to it early on, so to speak, and you're like, I want to help those folks when I get older.
Yeah, I was in after I took a yoga therapy training. I was invited to the MS Society as a volunteer, and went,
Really?
oh, these guys are really benefiting from this. And then my son's nursery school teacher invited me. She had MS. And I went to the support group at the doctor's office where she went, which was a pretty big office with a nice size support group. And
Okay.
they asked me to come every week after I visited the first time.
So it sounds like this is a thing that was just part of your life and it just kind of just grew like little by little. It just
It
kind of started to
evolved.
be the thing that made sense. So how do you go from like, okay, mom, I want to help you move to, oh, okay, world, I want to help you all move? Are there specific yoga moves that are good for MS or a certain practice that's sort of beneficial? Like, or is the practice overall beneficial? Talk to me, because people know that they should be moving, but they're not. So,
Yeah, we say in yoga therapy, movement is medicine. We have to be
mm,
careful that we say that, though, because it's not considered a cure. And
got it.
yoga therapy is still in infancy in its profession. But there are certain moves that people benefit from who have MS or different movement challenges. But almost every movement can be adapted based on the person's body. So we don't go, oh, you have MS, well, then you should do warrior pose.
Got it. Got it. So, so if there's no sort of general, you should do warrior pose because you have MS, right? Where does one sort of even think to begin their yoga journey if they have MS? They know they've been kind of thinking about it, but they don't know where to begin.
Right. So one of the best places to go is maybe in their community, they have an adaptive yoga class. Maybe check
Okay.
out different the MS Society or the Foundation or MS Views and News to see what's going on if they know of different classes in the community. But now, given the time we're in right now with COVID, there's Zoom classes that are available. So our Zoom classes have people from the East Coast, the West Coast, and I'm in Michigan. So what's really
You're in
been an
Michigan?
advantage is to have adaptive yoga classes online.
So what's adaptive yoga? What is that?
You know, I always say adaptive yoga and yoga are really the same thing. We're doing poses, we're helping each body individually. We adapt the pose to the person rather than push a
Mm.
pose on somebody.
Okay. So even if there isn't a sort of umbrella thing that MS patients and their caregivers could do, this is a sort of a strange question. I know that there's not one size fits all, but give us a one size
Exactly,
fits all.
exactly.
Like, where's a good place to start, even, you know?
Well, a good place to start is the breath. Because, you
Ah.
know, what sets yoga apart from other movement therapies or modalities is that we're focusing first and foremost on the breath. And I don't know anybody who can't breathe. So people realize right away, oh, I can do this.
Yeah, you
because it's
can.
the most important part of yoga is breathing. We call it pranayama. Prana means life force in Sanskrit, and chi, you might have heard that word
Mm,
used. They all get
got
back
it.
to the same thing. And interestingly enough, many languages, the word for spirit is also breath.
Got it.
Yes.
So essentially, we're building our body again from our breath up, so to speak. Yeah. Now, is there something you could share here with these folks in this like 10 minutes that we're here together, um, to sort of just help folk out?
So the primary difference in yoga breathing is the focus is on nostril breathing rather than mouth breathing. Because mouth breathing is more of a stress response. Our nervous system goes into this fight or flight mode. But we have this innate tool when we inhale and exhale through the nose that we have more of a relaxation response. Then we can
Okay.
be more balanced.
So talk to me about this cyclical breath. Like what is this cyclical breath? Breathing in through the nose and not the mouth and wait, what?
What? Well, there's umpteen different breaths, but we always start with the most simple, which is belly breathing. Rather than breathing through the chest, there is more of an even in and an even out. So, like maybe 3 or 4 counts, we breathe in and inhale, 3 or 4 counts through the nose, we exhale. It takes some time, but very often, just by focusing on the breath, people's breath starts to get nice and steady. There's no strain in it. It has a very calming effect. And for someone's nervous system that's kind of all over the place, just like our minds are naturally, it helps to calm our minds. So we've got this whole mind body connection.
See, no, this is why this because I meditate a lot, and now I'm sort of as I'm hearing you speak, I'm like, oh, this is why this is calming. Oh, this is why you are able to just sit and just slowly breathe when things are just happening around you, and like, oh, my symptoms or uh this life situation or like whatever. Eventually, if you practice enough, you sort of get to this place where you're like this it becomes a natural thing for you to do. And then you really start to feel how it's a good thing and how it's good in you. And that's really where the strength is, because you can understand that yoga's good. You can understand that meditation's good. But unless you walk through your own set of woods and figure out how it is good for you and how it can be good for you, you're not going to really know how good it can be. So that I'm very glad that you made that point in that way, Mindy. Thank you. So there's pranayama and breath work and things like that for the patients. But care partners, is there any sort of yoga for care partners, or do care partners do the yoga with their MS patients? Talk to me about that. You have some experience with that.
It's a really, I feel it's so important and perhaps not focused on enough.
Mm,
Just as the student or the individual with MS needs self care, so does the care partner. The care
absolutely.
partner is always in a position of, or very often in a position of giving and giving, and we want them to receive too, for them to receive the benefit of yoga. So, all care partners, when they come to our classes, are invited, and even on our Zoom classes now, care partners come. I have one care partner who sends me a note every week saying how much she appreciates the class. She feels
Wow.
better. She feels better. And sometimes I'll say, what does someone want to focus on? And she'll be one of the first people to say, can we do something with shoulders? I'm carrying a lot of stress in my shoulders right now. And then afterwards, she'll say, I'm feeling so, my shoulders feel so much better. And that's what's so empowering about yoga, is it's something you can do for yourself.
There's a lot of different things here. Like there's the movement, there's the breath, there's the shoulders, there's the legs, there's the mind. There's a lot in this whole yoga thing. Like, what are some things that people can? There's a lot of stress going on. There's COVID. There's the MS. There's the symptoms. Like, what are some things that you have maybe learned through yoga that can help either re-energize or refocus care partners or people with MS?
So when you meld it all together is when people really feel good, right? Like we've got
Mm.
this breath and movement at the same time. And some do gravitate to meditation and some don't, but some type of conscious relaxation, right? One of the greatest or largest symptoms, most prominent, is fatigue, right? 80% of people with MS have fatigue. Well, yoga is shown to help so much. There's actually studies about how yoga not only helps to improve quality of life, fatigue is right in there. I
So we
can't
were
emphasize enough care partners. I think
this is
oftentimes they get set aside.
right. Talk to me a little bit more about that. Like, so care partners get set aside. Like, what's this?
And very often the person in the caregiving role isn't used to receiving. And what's
Mm.
really cool, even if you look at the message of the breath, there's the inhale, the receiving, and the exhale, the giving. And the yoga is very much a part of that. In fact, it's so easy to even develop community with yoga.
Wow. No, that's a little sort of
That's
like
too out
heavy.
there.
No, it's not too out there. Like it's spot on, and
Okay.
things that are simple. Yeah. So people can say that it's simple, not easy, and that's something that trips a
Exactly.
lot of people up. Just because it's simple does not mean it's easy, and just because it's easy does not mean it's simple. So the care partner issue, it's a very simple issue. These people are caring, they're pouring their energy and time and love into other people, and they're not necessarily getting it back or filled up in the way that they're it's being given.
Right. So that there's a balance. In yoga, we talk a lot about energy. So it's just as important that the care partner moves as it is for the person who's being cared for. And really, you can look at it as a reciprocal relationship.
Mm.
And both the care partner and the individual doing the yoga or the person with MS should know that yoga is accessible. It doesn't have to be a fancy movement. It doesn't have to be put your foot behind your head. It can be as simple as lift your arm. It may not be all the way up as far as is within your range of motion.
Mm.
Do a little twist to your left, to your right, and simple, smooth movements, but nothing so fancy that it can't be done by anybody. That's why we say anybody and everybody can do yoga.
No, that's. I'm so glad that you touched on it in that way because it's a lot of getting started or doing too much or not feeling that you can't do as much as you should or other people are. That's a lot of resistance to just doing something. Bruh, can you turn to the left? Bro, can you just turn to the left systematically for the next 2 weeks, please? Can you just do that? And then maybe you'll be able to turn a little farther after the end of those 2 weeks, or to the other side, or etc. It's about
Exactly.
building.
And the focus is on sensation. So in mindfulness and in yoga, we're not looking for this exact perfect pose, but more, what are you feeling in your body when you lift your arm, when you take a side bend? So we become more in contact with what's going on inside, because very often people under stress, people get mad or angry at their body, people who are going through anxiety or depression, they become stagnant, and they also push their body away. What do you want to do when you're mad at something?
Get it out
Run.
of here.
Get out of here. Stop on it. Ignore it. So instead, this practice is bringing you inside. What does
Mm.
it feel like to stretch your leg out? oh, this feels kind of good. Or
Yeah.
it helps us define what is pain. What is
Yeah.
pain? Is stretching pain? Is that more of an acute pain, like a ping? Or is it more of a dull discomfort and feels kind of good afterwards?
Yeah, there's so much to it, to what you just said, and it's a lot of it is being where you are, starting where you are, and
Where you
then
are.
the exploration of it all. A lot of times the resistance is people have an idea of what it's supposed to be and what it's supposed to feel like and what it should. Nah, bruh, be where you are now and try to maybe do a little bit extra. Okay, no, fine. Then just try to do this,
Yes.
and you are making it what it is, and
We
your
could
I
take away the name yoga. And some studios do that, or some yoga therapists do that. They just call it mindful movement. Breathing and moving, putting breath and movement together.
that breath and movement, that's it. Start where you are, do what you can, and know that your idea of something might not be its totality, and you might be able to get more from it than your current idea of it. You
We
know what I'm saying?
often tell ourselves a story, right? A story about how difficult something's going to be. We think about what we did in the past, so it might not work. I have people tell me, oh, I went to a yoga class and I couldn't do it. It was way too hot in there. But what if you had a class that was more tailored to your needs, and the temperature wasn't 90 degrees, but it was 70 or 72 degrees?
Mm,
So we tell
mm.
ourselves a story that we can't do it. And then we try it. We come to this moment, we try it, and oh, we're pleasantly surprised.
Mm, absolutely. So you just keep touching on so many things that I know that I can just keep chopping it up with you here for way more long time than this program has for it. You were talking to me about like mudras and stuff.
Yeah,
Um,
so many people have seen, the different mudras, like this one's called Yana Mudra. You've
so,
seen,
so
like,
what
might
so
have
what
seen
is
a
that?
picture of the Buddha or a sculpture of the Buddha, and they're resting the
Right.
tops of their hands on their thighs or their knees. And so each of the different mudras have an energetic quality to them that actually runs through our body. And this is another thing that's very accessible to people with movement challenges, is using these hand postures or mudras as a way to do yoga. People
Mm,
love playing with them because it works hand dexterity too, but it has this energetic component when we breathe with it. So this particular mudra is the thumb with the pointer fingers, and that's the individual and the universal coming together. So the circle, right? Circle of
mm,
life. Well, so
hmm.
there's all these different mudras, and there's one actually that we use for people with movement challenges and neuromuscular, neurological conditions. And
Okay.
that is this one, where it's the right finger, the index finger, and the thumb, and the left hand is the middle finger and the thumb. And same thing, you can just rest this on your lap.
Mm,
It's
yeah.
it. So this is really accessible to many people.
Yeah.
They can have their hands up, their palms up, or their hands down. That's more of a receiving mode, to
Yeah.
have your hands up.
Yeah.
And then you want to kind of quiet down the effect of the mudra, your hands are downward.
Oh, do it one more time because I want to say it's on what? Say it again.
So the right hand is the index finger and the thumb.
Okay.
So that's this finger right here.
Okay.
And then the left hand is the middle finger and the thumb. And they just touch. They just touch.
Ah.
It's not like, oh, I got to push them so hard. It's just a gentle touching of the fingertips together. And then the other fingers are just kind of relaxing outward. And we can just rest the backs of our hands on our lap and practice a little
Wow.
breathing in and out. And that's yoga.
Yeah, the slowing down of the breath, the slowing down of the mind with that combined with things like mudras, things like movement is really what the whole yoga is about, but mainly what the whole movement thing is about, and to help you inch away from the mindset of like, oh, I can't do this, or oh, it's too hard, or you might actually be like, no, bro, I have not lifted my arm in 2 years. So I don't give me that glib stuff. I have this challenge. And it's like, yes, I know you have this challenge. I'm not even going to share mine with you right now because we're talking about you. I am saying that I believe you can get over that.
You
I
can get
believe
over that very often. It's the reason the arm doesn't go up as high is because there's a lot of spasticity and tightness. So at first it may start lower, and then over time it might increase. And it's very possible that a care partner may help you lift the arm safely up a little higher. You feel the stretch. It's okay to have a little bit of assistance. We use yoga props like blocks and straps to help us too. So when we're doing a pose and lifting our arm, we might have a little bit of assistance from our care partner. And that's okay. It'll help to release perhaps some of that spasticity. And the point is to feel the sensation, even if it's with the care partner, of lifting the arm upward. Or another example might be the care partners need a little pause in their day. And so they take some time to breathe together. That would be awesome too. They could go into more of a conscious relaxation pose and both breathe together.
That's it's significant because one, you're doing it together with your care partner, and you guys are both sort of sharing in a process that's healing both of you. One, two, this is not something you can go down to the CVS and pick up a prescription for $29.99.
No, and that's the point. You go to the doctor and they tell you what to do. But with yoga, you get to pick from the options of how am I feeling today? Oh, my neck's a little tight. Well, let's just give a little side stretch to the neck. Let's take our ear towards the right shoulder. Then we inhale up. Let's take our ear towards the left shoulder. But we get to choose where our focus is. We get to decide when we do it. And it feels so empowering. You get to do it for yourself.
It really, really does, and that's partly what this whole thing is about. Finding more information on the internet, finding more not care partners, but organizations that provide care that vibe with you and that you like, and you seek out. And it might be different every day. It might be different every 20 minutes or every hour, but you listen to yourself. You listen to your body, and then you give your body what it needs. And then maybe you try just a little bit more for the next day and the next day. And if that's too much, maybe get your care partner to help you.
Back off. You back off.
And then you back off.
It's too much.
And
that's what the yoga helps us to do. Because you know what? Very often people with MS are pushers, right? They want to do. So the yoga helps us to find that balance. When is the pushing enough? When is it too much? So we could just find that balance. When's it enough?
Wow. No, that's huge. That's wonderful. Thank you. And I'm going to just end on that. Like, you guys out here in the MS Views and News world, we've had a lot of discussion and a lot of topics got touched on here. And it's important for you guys to know that just be wherever you are. And just maybe try to stretch to the next thing. And if not, that's fine. Maybe tomorrow. But Mindy's talking about all these different, there's modalities, there's practices, there's so many different things that are not given to you on a prescription pad that require dedication, that require your time, that require your attention and focus, that also require time and cumulative time, over weeks, over months, for you to develop and to get better.
This is a practice. I'm just going to interrupt you there because yoga is a practice. We don't view it as a success or a failure, and very often people want to do that. But this is a practice. We come onto the mat. We do our practice every day. We do, as you say, be right here in this moment. And there's so many different resources to learn and choose from, as you say. And I'm very open. People can contact me, and I'll help them if they want to begin their practice.
Yeah, where can folks find you, Mindy?
So they can look up yogamovesms.org, and they can email me right from there. I'm at Mindy at Yoga Moves MS, and we can get them hooked up. If they want to come to one of the Zoom classes, they're welcome to do that. These are no charge, donation only classes. I have some adaptive yoga cards because they can practice at home if they want to. So they can tailor the practice to them.
Wow, that's fantastic. And thank you, Mindy. Thank you for giving me some of your time here. Thank you for sharing your knowledge and your expertise with the community, because clearly it's important to you and it's important to us out here. And you guys, there's another person out here with you being like, yeah, I know it's tough, but yeah, how come let's just try this. I'm here with you. I have this fabulous backyard behind me. Or I'm like, oh, I have this fabulous orange wall behind me. Let's see what we can do to push past this thing that we're in right now. So respect and thank you, Mindy.
Thank you.
And thank
Namaste, Damien. Thank you so much, because I know you get it. You get it. Be present, move, breathe.
That's it.
You
Be here
experienced
now.
it. I know it's in
Yep.
you.
Yep. No, it's in me. It's my life.
It's
Be here
actually in
now.
everybody. It's in
Yep.
everybody.
For sure. For sure. Absolutely. No, be here now. As in
Be here now.
MS Views now.
Be right here.
Right here, right MS Views now. Like, no, thanks for joining me, Mindy, and sharing some of your expertise. And thanks you guys for watching here at MS Views Now. And we'll see you next time.